So luckily, the most common form of skin cancer is one that it inherently is not as aggressive. It's called a basal cell carcinoma, and this one generally presents as almost like a skin-colored bump or even like a pearly-colored bump, typically along the face, but anywhere on the body. And it's very slow growing, so some people may even dismiss it as a pimple or even a mole. And so that's the most common form, making up about 80% of skin cancers. The second most common is called a squamous cell carcinoma. And this one tends to be a little scalier, like rough when you kind of stroke your fingers over your skin. And with this one, patients say that like even when you pick the skin, it doesn't go away and it may even bleed. But the scariest form of skin cancer, which luckily only makes up 1% of them, is the one that you see on the image right now, and it's called a melanoma. And this one tends to be probably the most lethal of almost all cancers that you can potentially get. And this is the one that's scariest because there's a 75% mortality rate associated with it when you look at it in relation to the other forms of skin cancer.
You know, this is a kind of a no-brainer question, but how can we prevent it? And then what are some of the ways we can do to protect ourselves?
Yes, so I think that recognizing the signs and symptoms. So for melanoma, it's the A, B, C, D, and E's. So it's an easy mnemonic to remember. A standing for asymmetry. If you have a mole, one side of it is a little different than the other, then that's a flag. B is for border, so you want like a mole that's nice and smooth all around. C is for color. You want the color to be homogeneous, so the same color on one pole as it is on the other side. D is for diameter. You want something that is less than 6 millimeters. And so typically if you have 2 of those signs or more, then that's generally an indicator for us to want to possibly biopsy it. E is for evolving. So any lesion that is changing, that is a symptom alone for us to want to biopsy it. And then from there decide if it needs like further removal, if it's actually becoming a form of cancer, of skin cancer like melanoma. And so those are the things that one can do in their total body skin exams, looking at your skin, getting really familiar with it at least once a month. And then seeing your board certified dermatologist at least once a year, especially if you have a history of, you know, having more than 5 sunburns in your life, which doubles your chance of having a skin cancer. But also if you have lighter complexion, lighter eyes, red hair, have had lifestyles as like being a lifeguard or perhaps a surfer or someone who's regularly out in the sun, then you're more at risk for having a significant family history of skin cancer. You definitely want to be checked out.
And you want to check even on your head, like places that you think are covered.
In your scalp.
You know, it is a misnomer to a lot of people. I know a lot of my friends when I lived in Seattle, they never wore sunscreen. They thought it was weird that I would put it on every day. They said it's cloudy, there's no sun, but those UV rays still come through.
And they're the scariest forms. They're UVA rays. 50% of that UVA is actually happening in the shade. So when it is cloudy outside, and that ray penetrates deeper. So it is more of a trigger also for melanoma. UVB is like the more superficial kind you get, you know, during the hours of 10 to 4 p.m. But it's just as powerful. And you're right, Maria. So things to prevent it would be applying your sunblock. Mineral-based is ideal, so something that has zinc oxide, titanium dioxide, and then the key is reapplying at least every 90 minutes. I like to tell my patients every hour, but no greater than every 2 hours.
Very quickly, at what point should you go see a doctor? What are you looking for there?
Right, so if you have something that is changing, a lesion that is changing, you should go see one. If you have something that is scaly and bleeds on occasion and it's just not going away, and if you have a lesion on your face and you're attributing it to be like acne-like or a mole that's new but has some little blood vessels or is skin-colored or pearly, I would also go see a board-certified dermatologist.
All right.
Important information, Dr. Sabrina Fabi. We always appreciate it, even though we haven't had a lot of sun lately. It's coming.
It's coming, guys.
Okay.
So,
and even when it's not here, we're still getting it.